So Assalamu alaikum, good morning, good afternoon, and good evening, depending on where you're joining from. And so on behalf of Association of Pakistan Physicians in North America, Medical Education Research, International Training and Transfer of Technology, or APPNA MERIT Subcommittee, I would like to welcome all of you to the webinar series where we've been meeting every 2 weeks at the same time on Zoom and talking about various research ventures going on. And we moved on from academics to pharmaceuticals to regulatory, and we are trying to cover all of this. So the idea is to trying to facilitate clinical research and try to make people aware of what are the resources available and how to connect them. My name is Dr. Sarfraz Hasni, and I am a clinical research physician scientist. I'm associated with the National Institutes of Health in Bethesda, Maryland. And on behalf of APPNA MERIT, I'm the moderator for this and would like to welcome all of you. In addition to welcoming all of our participants, a special welcome to students from the Shahid Mohtarma Benazir Bhutto Medical University in Larkana. I understand that a lot of students from that institute have joined this webinar today. So welcome to all of you and welcome to all the participants. And our discussants today are Dr. Saeed Uzair and Dr. Sarwat Hussain, who will be monitoring the chat and will be also discussing after providing their comments at the end of the webinar. In addition, some of the housekeeping issues are that if you have a question and answer, please, there is a Q&A tab. Just put your questions there and we'll try to get to as many as possible by the end. Otherwise, you can always email us and we can provide our email in the chat for that. And then before I introduce our speaker for today, one last thing is that we have created a resource for clinical research, and it's a very good resource. It's a WhatsApp group, and you're all welcome to join. We can leave the link in the chat box so all of you can join. It has it's an extremely good resource for anyone who's trying to do clinical research. So with that introduction, let's welcome our speaker for today, who is Dr. MASOOD JAWAID. Dr. MASOOD JAWAID is an accomplished medical professional who has an extensive experience in medical education, clinical and educational research and online education. He is initially trained as a general surgeon and currently working as a director of medical affairs at PharmeVo Limited, where one of his tasks is to promote research culture, provide opportunities for quality research, and establish research units all over Pakistan. In addition, he is also an associate editor of Pakistan Journal of Medical Sciences. He has published over 120 papers and has an H index of 30. And he also authored 2 books on scientific writing and medical writing. Dr. JAWAID has made significant contribution to field of medical education and research. He is also an adjunct faculty member at various universities and conduct regular workshops on research, including artificial intelligence or AI, digital education's peer review, presentation skills, medical editing, and journal publishing. So, it's a very broad overview and a brief overview of obviously a very illustrious career. But I think we all are waiting to listen from Dr. MASOOD JAWAID. So I welcome him officially from the APPNA MERIT behalf, and please take it away. Thank you.
Thank you. Let me share my screen. Okay, thanks a lot for this wonderful opportunity from APPNA MERIT for coming and presenting the PharmeEvo research partnership. It's an honor for myself and also for an organization which is PharmeEvo Private Limited. And thanks, I'm humbled to hear the whole of the description which you just said it. So it's just for the written purpose. Let's start from there. So PharmeEvo is our 2 words combination, farm and pharmaceutical and evolution. So basically when the PharmeEvo is established, so At that moment, it was an evolution in the pharma industry that will try to do something different from the others. And as I'll go progress and discuss about the contribution of PharmEvo in clinical and other areas, you can clearly see the difference that what is all about. So with the vision of developing PharmEvo in 1999 is to build a healthier society by becoming a leading and socially responsible global company through innovative solutions. So you can see from the first day, the intent is very clear that it's not only making products, it's not only doing business, is by innovative solutions. So our aim also, as you can see, our vision is our dream, a healthier society. So it's bigger than ourselves. So doing into the business of drugs is one way of achieving our bigger goal of a healthier society. So that's starting of those things with the main values. You can also see, apart from integrity, trust, respect, ethics, excellence is one of the important thing as well. So whatever we do, we make sure that it should be ethical standards, even if we have some ethical standards within the country at that point or not, because things are becoming stringent with time. But when we're talking about 20 years back, things are not shaped up in those days. So we follow whatever we do, our core values remains the same everywhere what we do. This is our state of the art manufacturing factory, which is at Port Qasim, which is one of the few such facilities which have a separate cephalosporin, separate nutraceutical. Things are all according to international guidelines and regulations. And we are not saying it's our own self. The given that is this is also assured by one of the leading organizations like World Health Organization. Recently we have been qualified as a pre-qualification with the WHO, because a dossier has to be submitted from one of the product, which is a tablet. And it's an honor for not only for PharmEvo but also for Pakistan, that in the world the first oral zinc solution pre-qualified is PharmEvo from Pakistan. So not a single pharmaceutical company around the world is having this qualification, but the first organization that was endorsed on 12th of July 2023 is PharmEvo. So that is a giant leap which we established from 1999 to 2023, that the only company in the world to have a pre-qualification for zinc syrup and tablet with the GMP regulations and endorsed by one of the highest stringent regulators in terms of looking after for those things. So that's wonderful for myself as well to part of that organization which work for the qualities and don't compromise or anything like that. We are from Pakistan, but we are multinational organization from Pakistan, and at the moment we have our products and we have our marketing and products available in 30 different countries, and it's also going up because our business development is working to go much of the other countries as well. So right now we are the 8th number of exporters, and we are looking forward for going in much enhanced numbers in this year as well. So it's not only Pakistan we are talking about good 30 countries. Now here you can see it's not about the products. Looking at this pinwheel, which is a CSR initiative, which is cause-oriented marketing, just like our wonderful leaders, the pre-qualification, the work major person who's involved is Nadeem Rahmat, the Chief Operating Officer. About pinwheel and these activities, the brain behind those such activities is Mr. Jamshed Ahmed. He is a cause-oriented marketer, and he developed such initiatives so that we can take our vision to the next level. Just briefly, Pharmacist, the Pakistan first toll-free number at that point was established. It's a service for any person to talk to the phone about drug interaction for anything poison, and with the specific evidence-based guidelines and all things, and people are using it still at the moment with the toll-free number. Then eDoctor, the second one is about innovations in digital age, about the healthcare physicians, and we are working in many different areas in those areas. Then discovering diabetes, because in Pakistan, diabetes is one of the most prevalent disease. 1 out of 4 person is diabetic according to IDF 2022 guidelines. So we have a CSR initiative in which we track trace and try to treat all those diabetic, not only in the major cities, but in far-flung areas with many free consultation, free treatment, and free investigations as well. Institute of Leadership Excellence is another such initiative which was formed in 2017 because the healthcare community is trained in the patient care. But one thing which is sometimes lacking is the skills and competencies of the leadership. They become head of the department, they become chair, they become vice chancellor, but they have not learned those skills scientifically, just like the business graduates and other going to do. So that's bridging the gap here about conflict resolution, about types of leadership skills, about presentation skills. So that's the initiative working on those things. From those who are literacy background and they want to work in that area, we have a Jahane Masiha forum, work very active in those things, arranging mushairas and other things. We have health TVs with multiple YouTube channels working in different domains for general public to guide them to awareness of diseases and primary and secondary prevention. Evo Talk is one such initiative of ours, which just like TED Talks, so inspiring lives, and we ask different leading persons in their capacity how they contributed to the country so that others can motivate, can inspire from them and do good for the society, bringing more than what their personal interests are. And the last one is, which is presented here, is Pharmevo Research Forum. And today we're going to talk about, because that is the one thing we started and make sure that this will require to be done. The first thing which we started when the company was established as a research oriented organization. And even the first thing which goes to the healthcare professionals from the Pharmevo is not a medicine or prescription for a medicine request. The first thing which goes to the healthcare professionals in 1999 is a book. Even they don't know what you are making, but they are given a gift of book, that which is we have printed at that point the golden words. So still we are known at many different people as this is an organization which books organization. They sell books or they distribute book. We don't sell it, but it's an organization which have so much interest in books that not the first product is a book, not a medicine which we work around. Why research? Why we chosen research from the day one? Because whenever we go to the physicians at that point, even also I'm at that point at the different side of the table, every person is saying there is less amount of data in local context, and look into it into the 2000 and all other things. So there is demands of the data. We have less research culture at that point. Even we require to do much more. And just sharing some of the stats right now. What are the recent stats? Skymigo is an organization which rates journals, countries, universities, countries about different criteria related to research. I selected 2022 last year and see the ranking of research in different countries. You can see the number one is China and United States. These are number of citable documents. And in this list in 2022, our things are not so bad. We are at 26th number. Pakistan is presenting here at 26th number with a total citable articles of 40 for 395 and 89. So it is not a very bad number if you see so, but if we go to this self-citation column, we can see that more than 50% of our citations are self-citations. A huge number of our things are self-citation, which is not a very good thing. You can see it from here. Let me have a spotlight if I have. Yes, so you can see from here, total there are around 40,000, out of them 25,000 as self-citation. That our research, either our journal is not going beyond the boundaries, maybe we are not doing research in par with the international research which is going on. So that is an alarming thing. Plus, if we see the H index looks like to be 381 is a good number, because usually it's done H index for the individuals. If we have a question answer and somebody asks about H index, we can explain them. But this 381 is not a good number in terms, if we see the journal, the country who is below us, 27 number of H index of 995. Okay, so that's is looking the data in another aspect, that we need to go to the research beyond our boundaries and what is the requirement, not only our also, of course, we need to go local contextual research, but once we do it, it will go beyond the boundaries as well. Another important aspect, by looking into it, this is the website of clinical trial. So it's the international requirement. Whenever somebody is doing a clinical trial, it must have to be registered in WHO approved clinical trial. So one of the registry is this one. There are others as well, but most of the time people are using this much more as compared to others. So you can see from this the last year data, how many researches have been started or uploaded into the clinical trial. I have just tagged that thing, and it is around 85,000 of those research, and out of them only 605 are from Pakistan. So looking at our scenario, the disease burden which can be researchable, the population which is easily accessible to clinical research because of the demography of people as well, plus opportunities which we have, this is a very less number of studies compared to our neighboring countries and others. So it's not only the evidence generation, it also about funding opportunities as well. We know that what is happening to the economy right now. So if we tag all the stakeholders at one place, all opportunities are created good, we collaborate with each other, we can generate good amount of revenue in terms of dollars coming to the country as compared to other way around. So but we all need to work together, just like APPNA MERIT is doing a wonderful job with awareness, with trainings, with courses. Academia have to come up with organization. The universities must have to do translational research, which give them the opportunity. They need to collaborate with industry. Industry have to give the share in terms of opportunities, fundings, and collaborations as well, and the regulators. So we all need to work together to truly impact those things at a national level. So let's me just briefly explain our overview of Pharmevo research journey. It started in 1999, and in 2002, we have established the first clinical research center in Karachi, which is by in a person from there, that is with Professor Abdul Basit, Bakai Institute of Diabetes and Endocrinology. And today, it is one of the state-of-the-art center of excellence in the world in diabetes care and research. And even from 2002 till 2023, we are continuing our unconditional support to that research center. And we started down from there, but things not stop there. From National Institute of Cardiovascular Disease, from Tabba Heart Institutes to the northern part of the country in Kashmir, we have developed multiple clinical research centers in Lahore, Faisalabad, so all major, and the other cities also we developed multiple clinical research center. And the one of the major, our professional or the our financial contribution be given to one of the research is CLAP IHD, which we have done in 2003, published in JPMA, the head-to-head trial of our product with the innovator. So that is another important aspect that we'll try to pursue and give our marketing things to a research related thing instead of doing the other way around. In 2010, we have formed Clinician, a division of Pharmevo, which is directly dedicated for the research work, which has started doing work all around the country. And then in 2012, we go to another level. Instead of only the organization, we have made and given the opportunity for an independent research organization, Health Research Advisory Board. It's an independent body incubated for quite some time with Pharmevo, so that every funding is given from the Pharmevo. It's collaborated with national agencies, national organizations, regulatory bodies, and doing in the research center. We go to all far-flung areas of the country with Dr. Abdul Basit, Dr. Zaki, myself, and other people. And we specially designed workshop of developing clinical research center in resource constrained areas. How in the meager resources also, if you like to do clinical research, what are the different steps, how you can go there, what are the different opportunities, and how Health Rep and Pharmevo can contribute to that journey. So it's a wonderful way, all other things. And then we have done the first international medical research conference in 2013. Another important aspect and landmark thing, in 2014, we started with multiple national registries. For example, CROP, which is Cardiac Registry of Pakistan, which is now also endorsed by government of Pakistan, just like this Drop Diabetes Registry of Pakistan, different joint registries, to name a few of the registries. There are more than 7 registries which we are working together. And of course, they are owned by the organization, by their institutions or the societies, but all finances, technical support, data entry operators, and multiple things are supported by Pharmevo Private Limited, by having those sustainable culture, because we realize at that point that we need a national kind of data instead of a simple institutional data, which we majority of the time we are publishing there. And that is the reason that they are not going for the impact, because they are restricted to 1 or 2 institutions as small center studies. In 2016, we again go to another important aspect of research awards. With the joining hands with different collaborators, societies, we have gone to the different research, cardiology research award, endocrine research award, orthopedic research award, gynecology research award. So multiple research award has been started. So motivate the juniors and the other way around, and give them the due credit, not only with the awards, but the cash prizes as well. And I'll discuss more in my one of the slides at the end as well. And in 2021, we have established PharmeEvo Research Forum. So now majority of the things we do at the research area is from the front end of PharmeEvo Research Forum. And many things which I'll go on to talk about is those. So that is the area which is right now, research is not at a very good hand. If you can see just the stat which I have shared, you can really imagine what is the state at 1999 and 20 and 21. So we started from those things and continue our journey in those areas. And again, with time, we are more innovative, more solving the problems, and things are going on. So what is the vision of Pharmevo Research Forum? So we have a wonderful list of advisors to us who help us, guide us. They know the impulse, they know the pulse of the healthcare people, as well as the problems and challenges, with the vision of developing a research culture. So we know, or they guide us what are the different areas, because personally my own experience in the research things as well. So even I myself know many of the things, what are the problem areas which we need to solve. So we continue our journey in all those areas. So it truly help whatever we would like to do. We like to solve the problem instead of just doing research for the sake of research, just doing some initiatives, but we need to solve the problem. That is the most important for us. One of the most important thing is capacity building. And of course, pharmaceuticals this is a very important area, because they have comparatively good financial muscles. They have a reach outside one institution or geographical area. They can contribute to that area much more if they really want to do it. But one more important thing is, we like to do our trainings differently. Our trainings are truly different as compared to what even different organizations are doing. We make sure that our trainings have 3 key features. Number one, they are short. They're not a very long and extensive courses usually. Number one, they are short. Number second thing, they are practical, because those who want to learn are usually clinicians. They are not the full-time researcher here. So they need to be understand from practical application, or those things which are more relevant to them. And the last and most important thing is engaging. If the training is not engaging, there is quite a lot evidences that it will not going to make sure that it has an impact. So we make sure whatever we do is different, and it's happened to me quite a lot. Whenever there's a first training at our organization, at institute, the Pharmevo is doing the first training, people are not very serious about it. They think that it's a pharmaceutical based something, a speaker come and talk about something and it will end, and we just have a good food and go away. So once the first training, it will really change the paradigm. Okay, they are serious, so there is more interest to, and that is a common all around, not only in Pakistan and outside Pakistan as well. The same thing which we experience. After the first thing, there is much more seriousness among our participants and the institutions. And we have just to give you an example, SPSS known to be a very boring or difficult thing as well. Just to present one of the feedback, we have multiple like this. I have never seen such a teacher in this subject, because I have learned it before and it was a mess. This time I learned a lot, keep it up. So you can see such difficult subject, we'll try to make it enjoyable, practical, so that they learn and apply. And just to give you an example, in one of the organization in Islamabad, my marketing is saying, sir, we want to do a workshop there, but those who are at the decision point, they said, we have done those workshops from College of Physician and Surgeon. It's a 5 days of the workshops and all others. Why we need to do it from your own site? So it's a quite a long time because they want to do it at that organization in Islamabad. So we planned one of the session there, and it's a 3 hour of the session. And before the session ended, they said, we like to have a long-term collaboration with you for multiple such kind of sessions. So that's a change in paradigm what we do. So it's not only what we do, how we do it is also very important. And my core belief and our core belief as an organization is do it with excellence, do it with full energy, do it with full motivation of your own self, and do it as much as possible to solve the problem. So we have the multiple trainings from SPSS to Google Scholar, in which we'll try to also teach them about H-index and how improve H-index, and what is this importance in the current scenario is. Publish or perish is writing a research paper, research methodology, including synopsis writing, reference manager like Mendeley, and Note. We train such kind of softwares as well, and also the PowerPoint. So many of our physicians are not very much savvy of making PowerPoints, which are really make an impact. So there is a workshop of around about cognitive load theory, and the PowerPoint will try to those teach the principles with the hands-on exercise. And even now we have more of the trainings of journal publishing, peer review. I'm also next week I'm traveling to Sawat region because one of the invitation is to conduct a peer review for their faculty members, because one of the journal is publishing there. They want that our reviewers are much more experienced, and they contacted us to do that training, and it's a very much an honor for us. Such kind of prestigious work and training, they looked at us to solve their problems and take them to the next level. Just a few glimpses. You can see the trainings. Our training, as I just said, is not the lectures. You can see people are working. I guess this is a yes SPSS workshop. One more important thing, we do the trainings as much as possible within the institution. We don't usually do it in 5-star hotels. So because our main focus is about the teaching and learning, so our main area is try to do such kind of activities in hospital within the premises to be more effective than the lavish lunches and dinners and the experience there. That is, you can see how much people are engaged with the content in those sessions. That is publish or perish, which is paper writing, and people are critique some of the research article, I guess, in this sphere. And you can see from their faces how much engaged they are with the content. So these images, especially I put it to give you an idea when we do something, how we do it, how much people are engaged with the content. And that is really something which boosts us all around. Whenever we receive some of the requests, people waited for our workshops quite a long time to conduct those things. So it's not only in Pakistan. As I have just mentioned, we are away, our presence is in more than 30 countries and going on. So our footprint remains the same. For example, that's another workshop which we are doing in Vietnam. You can see the smiling faces by looking at paper writing things. You can really see the difference among them. This is a workshop or glimpse of PowerPoint. This is in Philippines. You can see even the generation Z how much engaged with the content. And you know that we can discuss a long time that it's really difficult to engage the generation Z. So how much we engage them also in those areas in which they are considered to be more expert than majority of our age group as well. So this is just to give you an influence where, and this also going on, the workshop is also in the hospital setting at that point. This is just a last year in Pakistan. We are not restricted our these trainings to the major cities. These are some of the cities all in a 1 year time. Of course, that if we give the data of 5 years, it will much more than that. So we go to the Balochistan, Kashmir, to everywhere around the country to do the searching. You know how much costly this is to arrange, specialize all other things, because every training of our having a feedback received, and a report has been generated within 5 days about quality assurance. It will email to the facilitator as well as to the course participant what they are saying. And by default, we try to look into the quality indicators. If we find some of the facilitator not up to the mark, we try to either improve or change those things as well. So it's a complete quality assurance process, just like any organization, university, or academician, because of my personal background of academics as well. So that's you can see that glimpse into what we do in all other things. So these 3 hours, 4 hours, and sometimes one-day workshops are comparatively smaller ones. We go there, train, but those people who want to learn more, there are many who said we want to learn in a longitudinal program as well. We have started last year about certificate in clinical research, a university certificate course in online environment with web-based as well as synchronous sessions on Zooms. It's a combination of tools with a wonderful faculty member, again with the intent of practical orientation and practical application of those things, starting from having a research idea till publication and statistical analysis. And we have a wonderful feedback. The fourth course has just been finished and we have a wonderful feedback. We calculate NPS for them, which is one of the indicator of the yardstick of the quality. And we have the 100% people saying that they want to again ask their colleague to join the course, which is a for us also astonishing that how much people are happy with it. Just sharing one of the feedback, one of the participants, a very comprehensive and in-depth knowledge of doing a clinical research is given and elaborated in a very detailed way. So you can look with the feedback as well, how much people valued that thing. And this is in collaboration with Pakistan Journal of Medical Sciences, which is one of the highest impact factor journal from Pakistan from the last 5 years. Still, we are in the top journal, which is in collaboration with Pharmevo Research Forum. Another important aspect is we give research support, customize, individualized research support through all those who need it and those who are related to us, all other. And this research support is about statistical analysis, sample size calculations, article reviews, the technical reviews of the article before they submit to the journal. And sometimes we align it according to the journal guidelines of those things, because sometimes a very tedious job in many international journals, and you know that many of our researchers is not well trained and they don't have this much of amount of time to their disposal. And literature reviews, many paid articles will provide to them once that we receive the. Another important aspect is Turnitin reports. So before submission, we give this report to many of the authors published, they want to publish in the journal with those things as well, and manuscript refinement and changes in the manuscript, all other things. So these are, and usually it's a quite a long number in a year. For example, sometimes it crosses 250 plus. So you can see every second there is a request, and sometimes an article review, manuscript refinement, it takes us weeks of time. So at one point in time, multiple research projects are going on with us in the angle of research support as well. Another important area which we highlight is grants, funding opportunities. We don't have much more funding opportunities. We are not much trained, although there are many international funding opportunities, but we are not trained to grasp those funding opportunities. So we think about, okay, can we do something about it? Because of course, with some institution, we give them the grants and some of the thing, but why not going to the publicly and offering some grants? So those even we have not touched individually can apply to their grants on others. So 2 years back, we have started that initiative for a small grants of available 3 lakhs each of multiple grants will be given to those who want to apply. There's a simple process was done with budgeting requirements and all other things. A format was given, and this opportunity is also started around 2 years back. And not only that, we announce it, we go to the many institutions and then with the faculty member and the resident and guide them what is the opportunity, what is the criteria, which with the chances of fulfillment of their grant is much higher if you follow these guidelines. What are the areas in which they can publish, because it's about clinical research, so it's usually not for the basic sciences, but even with the basic in collaboration with clinical, you can work around for those things. So there is a, in the specialties in which we are, for example, cardiology, diabetes, respiratory, gynae and obs, pediatrics. So all those areas in which we are active, we like to also fund research things as well. And this is not limited to our sponsored medicine. No. So it can be any research, which of course go to the advisory board. Once the advisory board technically reviewed and approved it, then it's among the best will receive them. This is a image of King Edward Medical University, which we have done the session, and you can see in the middle the Vice Chancellor Khalid Masood Gondal. Right now is the Vice Chancellor of Fatma Jinnah Medical University, and other faculty members who are, we have a clinical grant sessions. This is in Peshawar, this is in Lahore, this is in Lahore of Fatma Jinnah Medical University. This is again in one of the image in Peshawar, in which not only we give the opportunity, we also trained all the resident about how to write synopsis. So this is the session, and there are multiple sessions. And after these sessions, we have received 46 clinical research grant applications successful. Because more than that, on emails we don't accept it. We have a form for that purpose. I'll share the link afterwards as well. 46 applications which we have received, and after scrutinizing and all other things, we have awarded 19 research grants. So that is a year back. They are in the process right now. Some are in the publication phase, some are still going on, some are at different stages of data collection. The maximum timing of application of any grant is they must have to complete within 18 months. It's not a 5-year plan, so they have to work around for those things. Even the opportunity grant is limited in area. This is not only the first one. In a few days back, just few days back, 2 or 3 days back, on 30th of August, we have announced the second episode. So it's a wonderful time to be here representing at APPNA Merit Research Academy. The new grant has been applied. The last date is 30th of November. So everyone who is listening can apply there, and I'll share the link in the last slide as well. We are doing a press conference because we want to go to the masses. We want everyone to know this thing. And you can see myself moderating the session on the left hand side. Then Mr. Jamshed Ahmed, I talked about the cause oriented marketing. He is the brainchild of Mr. Jamshed Ahmed. And then Shaukat Ali Javed is the chief editor of Pakistan Journal of Medical Sciences, as well as the chairman of Pharmevo Research Forum as well. Then Badr Fayaz Zubairi, one of the advisor, professor of medicine. Professor Jahan Ara, professor of gynae and ops, MS of Dow University Hospital, one of our advisor, a PhD and very active. Both of them, apart from other advisors, are very active in research. Those who are available in Karachi, we invited them. And the last one who's sitting is Mr. Harun Qasim, the managing director of Pharmevo. Without his vision, without his direction, Pharmevo need to work. It cannot do such kind of big things, such kind of opportunities. We are fortunate to have in the leadership position those who really want to contribute to the society. It's not only about the business, it's not only about the bottom lines, it's about making an impact in the society. So you can really see less amount of these things from a pharmaceutical perspective at this large level. So thanks a lot for all of them. And also that is one of the important thing that we are invited to do some talking like this. Another important aspect which I'll like to share about is the Pharmevo Research Excellence Program. So those institutions or organizations which want to do more of the research in the longitudinal run, we have this program. We work with them in starting to the end with monthly meetings of online, working with them, guiding them from starting of the data collection and making gamified version of those things as well. You can see one of the screenshot of Zoom meeting which we are doing about with multiple project, and we have signed multiple. Although this project is in the middle because it required two-way information transfer. So we can guide them, but they need to do work at their end. So sometimes you know that there is so much commitment from the patient care. So some of the institutions are lagging in those things, and also it's going in the middle, but that's another initiative. Phil, the last thing, research awards, because we want to promote a research culture. So multiple research awards are there. You can see this image of signing a MOU with Pakistan Society of Internal Medicine. You can see JAWAID Akram sitting here, apart from who's the president there. Then Pakistan Cardiology Research Award. You can see the leading cardiologist sitting here. You can see first Hypertension Research Award, and also Pakistan Endocrine Society President Dr. Abrar signing MOU, and we have the second research award in October. First already have done 1 year back. So we have multiple because we want to give more you can see a stage to the budding physicians and also the resident who are doing a research with both the cash prize as well as an award. We are the first, one of the first organization in Pakistan to offer the electronic data capturing services for our own researches and for also the researches which is available to others, with also FDA regulated database and the complete auditing, 21 CFR compliant, all other things as well. The last thing which I want to say, with the now everyone is talking about artificial intelligence. So it is so much of excitement, so much opportunities are here, that artificial intelligence role in research, how to do it. So we are proud to say the first pharmaceutical company to come and give a hands-on training of artificial intelligence in research in Pakistan. So of course, and you can see the glimpse of those things, the session in Karachi, and also you can see this is another image which I just selected. Said it's not, people are doing something right now. They are not, we are not giving a session, okay, these are the things which are available, but these are hands-on training. And the last session which I have done, because one of the session is done by myself, is in Lars in Aachen University Hospital with Pakistan Chess Society. So again, a wonderful experience, and we like to train people how to do in those terms as well. So it really changed our own work because we use many AI tools to enhance our work. We also trained others. And also coming back to, we have received a request from, for example, in Sri Lanka. So in October, we are having 6 sessions of artificial intelligence and research in Sri Lanka. In the same way, in all major conferences in Pakistan, the pre-conference workshop is by PRF and above. Last thing, our journey from 1999 to date, we have trained or changed the lives of more than 100,000 physicians all around. So that's a even it is more than that, but we calculated from 1999 to 2023, which is around 24 years. So this is a life, but there is lot more to do. There is lot more to do it. So we alone cannot do it. We need more people. We also joined with other people to make an impact around those world. So it's a long journey. It's not a straight walk, a straight road. It's just like this. A road like this, we all like to work together. And here I like to end my one way of communication here is, you don't have to be great to start, but you have to start to be great. So we are just giving our own 2 cents, whatever we can do it, but we like this to be everyone to be joining hands together. And again, I like to really thanks APPNA MERIT for this opportunity for us to share what we are doing. And I have also shared the link here. So all the grant opportunities, the workshops, everything, you can go to that link and you can find out those things as well. So here I end here. Thanks a lot. And again to Mr. Dr. Sarfaraz.
Thank you so much, Dr. MASOOD Javed, for a very wonderful and comprehensive review of the efforts that are done through your organization and you have personally been involved with. So very impressive. We are, I think the audience have learned a lot. So now I will ask Dr. Syed Uzair and Dr. Sarwat Hussain for their comments, and then there are a number of questions in the chat box. Then we will go to the quick Q&A after that.
Thank you, Dr. Sarfraz. But first of all, we will open up with Professor Sarwat. His dream is really to touching the student, and he must be very jubilant today to see the student participation. One thing, and he will share his views by himself. Over to you, Professor Sarwat.
Assalamu alaikum. Thank you very much. You know, it always surprises me when I attend these webinars that the work Dr. Uzair is doing is really a diamond mining. You know, every time there is a speaker, it kind of blows us away, at least blows me away, that the amount of work that is going on that at least I did not know about, and the amount of passion and resources that is being poured into this kind of activity is just totally amazing. So, but I do have questions, and the questions are, number one, how much resources is your pharmaceutical company is employing for all this work? Because that is the fundamental resource for, or the reason that you can deliver so much work. And what is your budget? And how many people are getting together to do this work? Secondly, is your company a Pakistani origin company, or is it an international company that you are a kind of represent the Pakistani arm of that company? And thirdly, what is the capitalization of your company at this time? So I'm gonna mute myself and listen to the answer. Thank you very much.
Okay, thanks a lot. Should I respond, Dr. Sarfraz?
Yes, please go ahead.
Yes. Okay. So as you said, we are doing multiple things, and a very good question you have asked. And astonishing, let me say to you, we have a team of 4 people full-time at Pharmevo Private Limited, including myself, who are looking and orchestrating all those things. But we have the many people which are all around the country. We involve them, as I said, with our quality assurance process at everyone. So in every part of the country, not in every, in the major cities, we have the people. So we take their supports in those things. For the full time, our team is only comprises of 4 people as compared to many others which have more than that, but they do comparatively sometimes less than us as well. And so the capital is, yes, related to, I think, is in crores, depending upon, I have presented some of the thing, but for example, we are supporting our research right now, which is starting there at one of the leading cardiovascular center, and we are giving them a funding of 8 million for only for one research compared to others. We have sponsoring many different other research related activities, which I'm not included here. I have only talked about those things which are directly by Pharmevo Private Limited, not the other thing in which we are investing and giving funding to them as well. So it is huge in terms of, because why we can do it, because this is our core marketing. We don't do personalized things to the healthcare, which is very difficult. I know many people, how you survive in this environment when you only offer such kind of academic things, not the other way around. But why we can do it, because all of our budgeting of marketing also goes into the academics. So that is one of the answer. Another question you ask about, it's a Pakistani company or other, it's a Pakistani origin company, the premier organizations. So the core group is Pakistan based organization, developed in established in 1999, and then we go out of the country. So it's a purely 100% Pakistani organization, and that is also a proud moment for Pakistan as well, that we are having a good name to all other countries as well. When they see it, they are very much amazed, not only the quality of the product, but the quality of services which we offer. For example, we have another training coming up in Qatar in the end of September with the ILE session of a leadership training. So what we do is the same thing in the other countries which we do. And about the, at the moment, we are organization of around 12 billion PKR. And we are at the end of last time, it was in the leading 18th pharmaceutical company in Pakistan. So it will be shifting between the different numbers as the monetary support. So these are some of the responses to your question. Thank you. Thanks a lot for asking these questions.
Yes, Professor Sarwar, do you have some comment? Please unmute yourself.
Gee, I think that's really wonderful. And my last question is, what is your annual revenue, so that you can, I just wanted to know that you can afford so much money for your passion rather than for revenue generation. And what are your major products, top 5 projects that bring you revenue? Thank you.
Okay, so our revenue is around right now is 14 per year is 14 billions. This last month we have close to 1 billion mark. That is a very good thing for our organization. We celebrated 2 days back about the 1 billion per month of those revenues. So it's increasing by time as well, and all because of academics. One of the core marketing is, so one of the top brand, as you said, is about low plate, as you have talked about. So that is the product we talked about in the first trial in IHD CLAP. Again, the innovator is low plate, which is clopidogrel. Then we have statins. Expanded is one of the brands. So we have multiple brands in diabetes. We have Inosita. So there are multiple brands, and majority of our larger brands are in cardiometabolic and cardiometabolic, which is related to cardiology and diabetes. But as we go along, there are multiple brands are also coming up in that area. I like to highlight here, we have another brand, which is our own brand, is Furfur. It's a different combination of iron with less side effects, with a very good increase in the hemoglobin rise as well. That is our own innovative products, and we have received the International Award of Innovation also for that product, which is Furfur. It is an island. We have the not only the Furfur, but in children's we have Furfur Grow as well. So this is a new technology, and so we have multiple lines of products to get going for the 1 billion marks as well. Thank you.
Is that many people approach us as a APPNA group for help with quality and for training. How would you like to collaborate with us and get you in touch with those people who seek our assistance and help? Thank you. This is my last question, and then we'll open it for others.
Yes, of course, we are doing so many of the things, and it's honor for us. So whatever we can contribute from the APPNA platform as well. So you already have my email address and also the other people in the organization. So we'll love to join hands together to contribute for the society.
Thank you, Professor Sarwat, for offering very generous training offer. By the way, Dr. Masood, Professor Sarwat loves training, development, and he was the pioneer and founder of developing the radiology department at Aga Khan University, Saudi Arabia, and many more places. And he's also in the process of writing a book about the radiology for the developing countries. So, doer, great doer. But at the same time, because a lot of students have also joined, I will encourage them to visit the APPNA website, and they will find a lot of material for training, for mentoring. They are offering some aspirant student who are planning to come to US. So they offer mentorship. They are offering the interview preparation. So there are a lot of activities they can find over their website. That's one thing. And second, if there is some individual question, concern, support, or mentorship, that can be arranged as well. But before all these things, my very, very genuine compliment. It was hard to believe. I wished, I had known it earlier, because what the PharmaEvo is doing, that's beyond the stretch of all my imagination. I could never estimate, because I know the Pakistani industry very well. So this much, activity, so much deliverable, phenomenal. Please do convey my sincere compliment to Mr. Jamshed, Nadeem, Harun Bhai, and all others. Really, it's a very, very impressive and very eye-opener, and maybe a benchmark to all the industry players. And that is the journey of conviction. PharmaEvo was a different. They always believe and travel, on the road, which was less traveled. I remember they are thinking they were sharing the corporate social responsibility, but they had a different pathway. but that is rewarding. So I'm so happy that they have crossed 1 billion monthly revenue target. And, they are going to the regional area as well. So we will encourage, training of the trainer. So we can offer you if you have a young budding physician, and for the postgraduate medical student, there's a lot of sport activity available on the website. And there is a special YouTube university from the APPNA. They find a lot of streams in the family practice and a lot more things. So those all resources are available. But particularly, I wrote as well, and I would like to mention, I'm really touched with the student participation, that they had some knack for the clinical research, and you, PharmaEvo, have inculcated in them, their interest, because I see that they are joining. So really, they are very warmly welcome. I have mentioned the WhatsApp link for a lot of material which is available in that group. I have put it. So anyone can join. So I put the link. And then there is a digital skill resource repository on the WhatsApp, so they can find a lot of material. I update it on daily basis. So that's to your team, to your leadership, your 4 associates who are with you. So that is the difference between ordinary and extraordinary. That little extra create a big difference. And I love the Zig Ziglar. You become great when you start doing something. And management is not doing great things. It's doing small things in a great way. And that's the message for today. There is just somebody asked about that, why should we pay for the courses if we can do these courses free of cost from Johns Hopkins and Coursera? Yes, there's a lot of material available, Vahiduzama. No one is selling any course really. So all these are the free services which are available to most of you. And you will find a huge repository of all aspects of clinical research on that WhatsApp. All are recorded videos from National Institute of Health, National Cancer Institute from US. So you will find all the material. And taking this liberty, I will request Dr. Sarfaraz Hasni also that being an industry partner, whenever he's planning a trip to Pakistan, get connected with you. He's going to deliver a grand round at Aga Khan University, maybe at Lahore, every year, maybe once a year. So this time it's going to be a different, to be coordinated with the industry who are actively engaged into the promotion of clinical research. So phenomenal. So all the best, and now it's over to Dr. Sarfaraz to formally share his sentiment, assure his support to you and the PharmaEvo and to the young medical student and the postgraduate students. So it's over to you, Dr. Sarfaraz.
Just
Okay,
as we
thank
go
you
to
so
Dr.
much.
Sarfaraz, let me say a thank you for the warm compliment which we are going, and I'll also give this compliment to others. And also, I'm much amazed by the really so much of the content which you are sharing daily basis on the WhatsApp group, in both groups. So I'm part of that group, so I'm honored to be those things, and really look forward that so much time and energy to put in to curate some of those content and share in the group, and really very much contribution from those aspects. Thank you.
Okay, great. So again, thank you so much. It's a wonderful session. And I think we have learned a lot, and I can see by the number of audience and the questions that it was very well received. Again, for those who are joining us for the first time, these videos have become available at the YouTube channel very shortly after the end of this session. I think if we can just put the YouTube channel link in the chat, that will be helpful too. And again, thank you so much, Dr. Masood Javed, and thank you for our discussant panelist, Dr. Saeed Uzair, Dr. Sarwar Hussain, for their insight. And last but not least, the technical support that a lot of background work is done for these webinars. So Waleed and his team, thank you so much for your ongoing support for this. And thank you for joining, everyone. We will see you in another 2 weeks with another of this series. So please stay tuned and be on the lookout. And we will join you again on Saturday in 2 weeks at the same time. Thank you so much. again. Goodbye, Lapis.